The next virus family we're going to talk about are the Toga viruses, with rubella virus being the most clinically relevant virus in this family. The other viruses in this family are all arboviruses that are associated with encephalitis. And remember, I said those are very difficult to ask questions on because there's really no good way to differentiate one from another. Okay? So the arboviruses are affectionately known as E, W, and V, but we're going to spend the majority of time talking about rubella virus. All of the encephalitis viruses, again, transmitted by the mosquito, and the host are bird and horses, and we talked about birds for St. Louis encephalitis and West Nile encephalitis, and again, just very difficult to ask questions on. One of the good facts that you might want to know about E and W actually are there are kill vaccines available for those if you happen to be traveling to an endemic area. Now, the one I want to spend the most time on is rubella virus. Two different things we have to talk about here. Number one is what happens when a child or an adult gets rubella virus, and then what happens when it crosses the placenta. All right? So what I'm going to do for you is compare and contrast a little bit. First, rubella with rubeola or measles, okay? Because the diseases look very similar. The rash looks very similar, and you're going to have to go on a couple of very small details in order to distinguish those two diseases. First of all, the rash for rubella, which is basically just kind of a macular rash, starts on the forehead and just kind of works its way down. Whereas for measles, which we haven't talked about yet, measles virus usually starts below the ears and behind the neck and then works its way down and eventually will cover the face. So there's a little subtle difference there. Now, can you definitively say it's one versus the other based on that? No, you really can't. Another major difference is that you're much sicker with measles than you are with German measles. They sometimes call German measles 3-day measles and rubeola measles the 7-day measles. Okay, so you're much sicker with measles than you are with German measles. So that's a clinical presentation of when you acquire this through the respiratory tract and you get this xanthan disease, okay, that used to be very common in children, but again, now we have a vaccine. Now, why we're very, very strict with the vaccine in the U.S. is because rubella used to be really one of the leading causes of congenital infections before we started vaccinating. And there are some classic things that you're going to see with congenital rubella syndrome that will help you, hopefully, differentiate it from some of these other agents that cross the placenta. The first thing I want to point you out to is cataract formation. So you're going to have an infant 3-4 months old with cataracts. That's extremely unusual. And they love to ask about cataracts in an infant and then ask what were they likely infected with in utero. Rubella virus, okay? Also, deafness is very common with congenital rubella. Not specific, not as telltale as cataracts, but also very common. The other symptoms, including patent ductus arteriosus and pulmonary stenosis, again, you can have cardiac disease with a lot of the other agents that cross the placenta, so that doesn't necessarily make it a specific diagnosis, but again, the cataracts, that's the thing they really like to ask about, okay? The virus itself is teratogenic, and the effects are more severe during the beginning and the first trimester, again, because that's when organogenesis is occurring, okay? So we have German measles, the 3-day measles, starting at the top of the forehead and working down. Then we have congenital rubella syndrome, in which I want you to think about the cataracts and deafness. We do have a live attenuated vaccine for rubella, and it's part of the MMR vaccine. Measles, mumps, and rubella are all covered in the MMR vaccine, and this is a live attenuated vaccine. This is an example of the kind of nondescript rash that you see with rubella. And again, just looking at that rash, you're not going to be able to differentiate it from measles. You're going to have to look at some other things. The overall health of the individual. There is also very pronounced lymphadenopathy with rubella, and that's not as pronounced in infection with measles virus.